Hi, everybody,
Hi.
and welcome to another exciting edition of Living at Your Highest Quality of Life with the doctors at Inspire Wellness. I'm with
Dr. Jessica Hutchins.
and I'm Dan Nitis, and we're thrilled to be here with you. This is a topic that we've been asked about repeatedly. Heartburn, gastric esophageal reflux disease, the use of medications to treat these problems and their overall safety. So we figured now's a really good time to go over these issues, heartburn specifically, what are the triggers, and then what do we do about treating it when we have it.
Right. And I guess the big issue I wanted to focus on today is that people are prescribed these, what we call proton pump inhibitors or acid blockers, things like omeprazole, Nexium, pantoprazole. There's probably about 5 or 6 of them out now. And they get renewed. The prescriptions keep getting renewed without much thought as to, is the problem resolved? Are they still having symptoms? Are there any side effects that need to be worried about?
Well, actually, it's even more concerning than that because they're over the counter. So
right, now they are, yeah.
Nexium, Prevacid, Protonix, Prilosec, these are the name brands that you may be familiar with. But the fact that these are now available over the counter tells us that patients can take them forever without any medical oversight, and it is contributing to problems that we're seeing in the field of chronic disease. So that's what we really, we do want to spend some time talking about that.
Right. And as a family medicine doctor for 20 some years, were you ever really taught to look out for side effects? Were you taught a time frame to recommend these drugs for people?
Well, so the interesting thing is, and I won't bore with great details, but I went to medical school at The Ohio State University, and one of the former deans was Dr. Zollinger. And Dr. Zollinger was one of the members of the team that discovered Zollinger-Ellison syndrome. And these are patients that it's a very rare condition, but these patients had benign tumors in their GI tract that would cause them to oversecrete or overproduce hydrochloric acid. And so these patients, these very limited number of people, would have recurrent ulcers, and their quality of life was so poor. So when the very first proton pump inhibitor, and they would have to have surgeries to, oftentimes treat these erosive ulcers. I mean, it's a bad, bad condition to have. And so when Prilosec, or omeprazole, was the first proton pump inhibitor, this gave new life to these people who could finally shut the production of their acid off, and they could have a quality of life. So I was in medical school from 1988 to 1992, and so this is the time frame of when the first proton pump inhibitor, or PPI, came out. And so what we were told is that the indication was only for people who had Zollinger-Ellison syndrome, or we started to broaden it to people who had very severe erosive gastric reflux. Again, this could be life-saving treatment. But one thing that I do remember is I used to have to fill out these ridiculous forms for prior authorizations because the medication was so ridiculously expensive when it came out. So the insurance companies would limit the number of people or the people who they would approve it for. So this was a very, very rare drug or series of drugs that was used initially. And then it was, if I have any heartburn related to anything I'm eating, I'm just taking Nexium, or I'm just taking Prilosec. And now that it's over the counter, it's take, without really recognizing what the risks are.
Right. And there definitely are risks. So,
well, then you also asked me, were we taught anything about how to use them, if there were any nutrient deficiencies? And the answer was absolutely no. We were not, other than if somebody had H. pylori, which is a very specific bacteria that can contribute to peptic ulcer disease, there was a time frame as far as, and I believe it was like 8 weeks, you'd be on antibiotics with a combination of a proton pump inhibitor and Pepto-Bismol, and then I'm trying to go back to like the 90s. But again, so that was a very specific time frame. Now it's, you have heartburn, just take Nexium every day. Right. And that's where we're at.
Right. And people remember their doctors prescribing it just endlessly. And so why wouldn't they just take it over the counter, for an undefined amount of time, I guess. And, I'm not saying that they have no place at all. They do, for sure. I mean, there are conditions where the acid actually causes changes to the cells in the esophagus that can lead to precancer and cancer. Someone asked this morning on Facebook about Barrett's esophagus, and that's a great point. So in that situation where there's, the higher likelihood of cancer from the erosiveness of the acid and the damage to the cells, then maybe the risks, don't outweigh the benefits of taking a proton pump inhibitor. But for most people who need it or who think they need it, like let's say you do have an ulcer or H. pylori and you're treating it, a 2-week course is what I would recommend. I would be very hesitant to have anybody on a PPI or acid blocker medicine for longer than 2 weeks, again, while you're treating whatever the underlying root cause is. And that's where we come at it from functional medicine too. We always want to treat the underlying cause. There's so many people who actually have too little stomach acid that end up having reflux symptoms. And one of the reasons for that is if you have too little stomach acid, that's what digests your food, especially meats and proteins in your stomach. And so when that doesn't happen, the food just sits in your stomach and it can actually physically, make pressure on the lower esophageal sphincter to let it open a little bit and have the acid come up. Because again, we need acid. So suppressing acid definitely inhibits digestion. It also inhibits the killing of certain organisms. There's a higher incidence of candida or yeast overgrowth in the gut. There's certainly a higher incidence of getting C. diff too if you don't have enough acid reflux to kill some of the organisms.
Right. So sure. Again, let's highlight a couple things that we just said because I think you glanced over pretty fast. Barrett's esophagus is a condition that we would agree, looking at the risk-benefit ratio, because Barrett's is a condition where we're starting to see changes in the esophagus that can eventually lead to a diagnosis of cancer, not in every scenario. And it's actually, I think, kind of on the rare side that it actually happens. But because with Barrett's esophagus, it can increase the likelihood of changes going from atypical cells to dysplastic cells to frank cancer cells, that in that scenario, the benefit of the drug might outweigh the actual risk. But for other conditions, let's try to figure out the root cause, again, because we need acid to break down proteins, and hydrochloric acid does act as a barrier and protects the microbiome. So think about when you're outside in your garden or you're going apple picking, and you pick something off of a branch and you start eating it without cleaning it. We know that it's loaded with organisms, but almost all of those organisms are going to be neutralized as soon as it hits your stomach because of the hydrochloric acid. But if you're taking a proton pump inhibitor and you don't have that protection, those organisms then can get into the microbiome and not just lead to disruption in terms of, a yeast overgrowth or all these other organisms that are competing for food. But we know it's the microbiome that enhances the activity of our immune system. And in fact, the microbiome is so critical for our overall health from top to bottom. So let's protect it.
Right. And another condition that, again, the risks might not outweigh the benefits is if you have a really large hiatal hernia too, which I've definitely seen results from going to chiropractors for hiatal hernias. I'm just not sure the large ones can really be manually manipulated like that, like the small ones can. So in that case, you might want to be on a PPI or acid blocker. And so some of the big long-term consequences, and these are real. This isn't just, 1 out of 100,000 people who use these drugs. We see them a lot, but fractures for sure. So the decreased mineral absorption from the acid blockers really contribute to fractures. And, I think everybody knows the older you get, the more dangerous fractures are. And people die literally from fractures all the time, from being in nursing homes from them, from rehab, having to rehab. It also increases your rate of pneumonia, and like I said, C. diff.
I think I remember, again, from my prior years, the statistic, a hip fracture that occurs in someone over the age of 65 has a 25% mortality rate associated with that. Right. So this is a real phenomenon.
Right. And if your bones are weak and you fall, which a lot of people, older people, their balance is off a little and they trip over something in their living room or fall on the ice outside. And today, be careful with that, and if your bones are brittle, they're going to break. So some of the nutrients that we know the absorption is decreased with the PPI, magnesium for sure. Also other minerals like iron, but B12, that's a big one too. B12 for sure. So you need stomach acid to absorb the B12. And if you're already not eating a lot of meat, let's say you're vegan and you're taking a PPI, then I would for sure get your B12 levels checked. Those are probably low. And vitamin D, there's been some reports too that decreases the vitamin D level. So minerals and the B12 are the big ones for sure. And because of that, then you see the increased production of these diseases like hip fractures and things like that. And there are several studies linking Alzheimer's and dementia to PPIs too. Less so now. There are conflicting reports. Some studies aren't finding it, some studies are. But again, if you don't have the proper nutrition that you need, your body is, of course, going to develop these diseases and chronic conditions for sure.
Right. And again, for those of you who are dealing with chronic PPIs and want to figure out a way to get off of them, that's what we're here for. So please let us know how we can assist in trying to do the deep dive and figure out, again, what is it that is in the body, that's the body's being exposed to, that may be causing the symptoms themselves. So the answer is not just keep taking a drug. It's trying to figure out how do you reestablish that balance or equilibrium in the body so that you don't have to rely on them. So, let us know if we can help you in that way, get off of these medications.
And diet is really important, but it's not the diet that you might be advised to follow from your GI doctor, like spicy foods, acidic foods, peppermints, things like that. That will cause more acidity, cause more burning, but that's not the root cause of why the acid reflux is there in the first place. So foods like gluten and dairy, for sure, are probably the two most common foods that when people get rid of them, their acid reflux goes away, completely. It doesn't work 100% of the time, but it's certainly worth a try, and it doesn't have any risks involved. And sometimes treating a dysbiosis or an overgrowth of bacteria or yeast in the gut too, and in the stomach can help that as well. And remember just to try to digest your food. Even if you're on a PPI and you after you hear this information, you want to try to wean off of it slowly. You've got to digest your food. You might have a rebound hyperacidity, meaning you might feel heartburn, even if your underlying problem has gone away as soon as you stop the PPI or even Zantac or something like that, because again, for a couple of days, you just might have an increased acid production. So weaning off is the best thing to do. So you don't say, oh my gosh, I really need this drug, and you go right back on it.
Good point.
But
you also mentioned something about Zantac. So it's important for people to understand that we have different categories of acid blockers. So we're really highlighting the proton pump inhibitors. Zantac and Tagamet and Axid, those are H2 blockers or histamine 2 blockers, which act in a different way. But again, relying on those to avoid heartburn as opposed to figuring out what the triggers are, again, isn't necessarily going to be in the patient's best interest.
Right. So please, if you want to get off of your PPI for all the reasons we just listed, come in and see us, and we have protocols that help, wean people off. Some people can stop right away, but most people, it probably needs a little bit of weaning. There are a lot of supplements that can be helpful to help heal that lining. DGL, which is a form of licorice, can be really helpful. Aloe, and there's a lot of gut healing. Glutamine, which is an amino acid that helps feed the cells that line the gut, gives them the energy to repair themselves. So again, come on in and we'll help you through this. We'll guide you through it step by step, and we'll get you off of these medicines so you don't get one of these long-term consequences in the future. And, food poisoning is another thing I didn't mention. So probably wonder why, if everybody goes to the same restaurant and eats the same thing, not everybody gets food poisoning, although these days that might be different because everybody's so sick. But it really does depend on that stomach acid, like Dr. Ninus was saying before. It's trapping those bugs there before they can take hold and, lower down in your GI tract.
Absolutely. Great.
All right.
Any other last minute tidbits that we should talk about regarding any treatment?
Always get to the root cause of any chronic symptom. Please remember that. And, we can get to the root cause, even if it is an H. pylori infection. There's still plenty of ways you can test for that without having an invasive upper endoscopy done. And certainly, plenty of people we see have gone to a GI doctor, had an endoscopy, and told, well, I didn't see anything. Everything's fine. Here's your Prevacid or Nexium or something like that, just because they almost feel like they have to give something.
Right.
So again, if that's your situation, please come in. We'll figure out the root cause, and we'll help you get off these medicines.
Awesome. Well, thanks. That was a good overview. And again, if you guys have questions, you can reach out to us on Facebook. If you have other ideas for topics on Facebook Live, certainly let us know. Otherwise, we really appreciate your participation. And remember, it's your time to thrive. Let us inspire you. Have a great week. We'll see you next week. Bye-bye.